The next patient that you're going to see that we've done treatment for is Anna. When Anna came to see us, she only had 3 teeth remaining on her upper. She had lost all her lower teeth. It certainly affected her functionally, affected her psychologically, and even I believe you're going to hear her talk about her health. We were able to give her permanent teeth. We had to do a lot of work for her, build up bone, do bone grafting, and we were able to do it in a manner that she was unaware of. In other words, we didn't have to do bone grafting from the hip. I think her words will explain better and tell you more precisely what her experience has been.
When I came to see you in 2008 and I learned what kind of work needs to be done in my mouth, I decided to get second opinion. So I went and saw 2 other specialists, and the process took 2 years to figure out what is it. And really, at the end of those 2 years, I still wasn't happy with the answers I got. As a matter of fact, I wasn't happy with the way the work would have been done if I didn't go with you, because I was sent from one specialist to another specialist to another specialist. It turned out that the other doctors weren't doing everything. They weren't the people that were doing everything. So one person would be doing bone graft, another person would be doing implants, and yet somebody else would be fitting my teeth. I didn't feel comfortable with that. Not only that, they also told me that the bone graft I need to have it done, it would have to be taken from my hip, and I was a marathon runner, so that was not an option to me. As a matter of fact, they told me that that's the only way. And I already knew that it wasn't true because you told me otherwise. I lost most of my teeth at a very young age. So for last 30 years, I was wearing dentures. When I was young, I wasn't really thinking about it. I was busy bringing up kids and stuff. But as I started getting older, it became a problem. Not only the fitting wasn't always right, and I was very aware of the sucking and clicking sounds that my denture made, which made me very conscious. I wouldn't smile, full smile. It was always half smile because I didn't want others to know that I have dentures. Not only that, the main concern was that I wasn't able to chew my food properly. So I had 2 teeth left on the top, and I was biting and chewing my food with those 2 teeth. And I started having a lot of digestive problems. And that's when I decided, okay, I hopefully still have lots of years ahead of me, and I better take care of that. That's where I came to see you. I didn't have teeth for 30 years. My bone became a paper thin, and it wasn't able to hold the implants that I needed to put. And of course, I want to have it done once, and I want to have it done good, so I don't have to deal with it for the rest of my life. I needed a bone graft done, and of course, bone needs time to heal. During the process, one implant failed, and I have to say that I wouldn't know. I was very happy when you detected and said that, I'm sorry, it will take a little longer than we anticipated because one implant failed, I have to replace it, and which you did, and at no additional cost to me, which again made me very happy. And I didn't mind waiting the extra few months. The whole process took about a year and a half, but again, it's just because I needed the bone graft done, and the bone needs healing not only on the top, I also needed the bone graft on the bottom. I do have a lot of implants in my mouth. I have 8 implants on the top and 4 implants on the bottom, 2 on each side and bridges in between. So I do have a set of new teeth, and it's literal. So I didn't mind the wait because I had the confidence that it's done right. And at the end of the day, that's what really matters. And no, there was no additional cost to me, which again mattered and made me happy. Everybody says that, what happened? You look prettier. And you know what? I like myself. I like looking in the mirror right now. I like smiling. I walk around and I'm smiling all the time, and it's not only because of the diamond that I've got here, but because I know I have a set of beautiful teeth, and I gained self-conscious. I can chew the food, and that is amazing. The food tastes totally different. I don't have this plastic in my mouth anymore, so it tastes better, and the texture is totally different. I'm enjoying eating, and and I enjoy smiling. I just absolutely, I can not imagine now how I could have gone for 30 years without it. You know what? If a friend asked me if I've got some problems, I need similar work done, and what do you think, should I have it done? I would tell her, not only have it done, I would tell her, don't go anywhere else. Go to Dr. Bullock, because what I liked about you was that you are the one-stop shop. You were the one that did everything. You were the one that did the bone graft, you were the one that did the implants, and you were the one that was fitting my teeth. And when I was getting other opinions, it turned out that wasn't the case. Somebody else would be doing the bone graft, somebody else would be doing the implants, and yet somebody else would be doing the fitting. So that is very comforting to know that somebody is so knowledgeable that can do it all. And I don't have to be running around to different offices and see different people.